Thank you, Mr. President, dear great colleagues and colleagues all from Europe. Thank you for the invitation. And first, reflecting for Mr. Konstantinos, I would like to tell you that Hungary is one of the countries among Greek and Italy, which is also the gate to the European Union. In the last few months, during the summer months, we had 200,000 people coming through the borders to Hungary. So thank you for your invitation. In my presentation, I'm going to tell you the history of the last decade of the Hungarian pharmacy, highlighting the issues of ownership, results of the liberalization, and also I would like to show you the way of the regulation, how we done it. The critical year in our life was 2006, when we had our parliamentary elections, and in Hungary the Social Party was re-elected. The Social Liberal Coalition introduced a liberalized pharmacy model among many other changes in the same manner in the health sector. It happened very fast. It took only a few minutes, so not really minutes, but a few months from the first idea was appeared till we can read it in the bulletin as a law. So we felt that time that everything was destroyed, we've built in the last years. It was the year when Hungary had a conversation and negotiation with the IMF and also with the antitrust authorities on the European level, and the Hungarian government automatically accepted all the advices what was given for us. So I think many people will analyze and do analyze what has led us to 2006 in Hungary. I'm sure it will be one of the hottest topics between the Hungarian colleagues for the next years too. One reason what we can and what we has to identify that the only aim was for the Hungarian colleagues that we wanted to hold the status quo. So we don't want any changes. Perhaps I may tell we cannot understand what the time says for us that time. But to understand all this, let us go back until 1950, because in the eastern countries, also in Hungary, from 1950 to 1990, we have only state-owned pharmacies. By the end of this period, we have 1,400 pharmacies. In 1990, parallel with the changes in the Eastern Bloc, it was the possibility to open or establish new private pharmacies. So in the next 4 years, we had 1,800 pharmacies. So in 1994, it became necessary to have a new law regulating the establishment and ownership rules of the pharmacies. Also, this was the year when our chamber could start acting as a legal entity with compulsory membership. You can read the key element of the law on this slide, but there is one only thing I would like to mention. It is the last sentence or the last line, because the preambulum of this law refers to the unlimited and financially unlimited liability of the pharmacies. So not only the financial, but the professional liability is unlimited. So it was one of the core issues of this legislation. And we do think that it still belongs to the philosophy of providing good pharmacy service. It was followed by a period when nothing has changed in Hungary. I mean, with the legislation, only a small thing in the year of 2000, when the Hungarian parliament adopted a law which said that all the share of the pharmacist in pharmacy must have at least 50%. They had 6 years to fulfill this criteria. It was that time our dream that it will be successful, but it was not. I'm going to tell you why. So I'm going to give you a timeline starting with the liberalization, 2006, then 2010, when I can say we start recovering, 2014, the consolidation, and we have a special deadline for 2017, and we do believe we will be successful doing that, what we have been failed in 2006. What was the elements of the liberalization issue in 2006? I listed it here for you. I think one of the key problems was that most of the pharmacists were persuaded that they don't really want to have bigger shares in the pharmacy. Because of the privatization issues, we had a prohibition for integration between wholesalers and pharmacists, but it was not for the indirect integration, only for the direct integration. So many pharmacies in Hungary, after the privatization in the early 90s, was owned by a pharmacy chains. 2006 was the year when they could appear, so when they could come visible for everyone, for the politicians. They were hid in the last 12 years, from 1994 till 2006. The next two slides shows in numbers and then in words some of the figures what has happened after the liberalization. After 4 years, the number of the pharmacies increased with 20%. So we started with 2,000. Then in 4 years' time, we had 2,400. And there's other interesting figures about the stocks. After 1.5 years, it made the stocks increasing. So our colleagues lost in the volume 12%. It means that there are permanent stock problems, so became permanent stock problems due to liquidity problems in the Hungarian pharmacies. And if you see the wholesalers' price per boxes, they were decreasing. So the state, or the sentence, the antitrust authority always says that more pharmacy makes lower prices. It was not true in Hungary. So some more consequences in words. What we feel, or what we felt after 4 years, professional independence of pharmacists is not guaranteed. The pharmaceutical supply of rural areas did not improve. The increased capacity in towns absorbed patients from rural pharmacies. A smaller pharma market cannot maintain so many pharmacies. The profit has become more and more concentrated. 50% of the tax income is shared by 1/6 of the pharmacies. There is a growing number of unprofitable pharmacies, so that's why the government has to introduce a new subvention model, and in Hungary 400 little rural pharmacies gets money from the health ministry to run the pharmacy to be able to survive. Less and less pharmacies deal with individual preparation, so it affects the services we can give. Owners are not efficiently punishable in case of irregularities, because the chamber has the power only for pharmacists, not for the owners of the pharmacy. Vertical integration leads to growing wholesaler influence. We can say after 4 years, it became an evidence that this model is risky and causes the inefficient operation of the public job supply system. Some overriding interest, supply security, the predominance of professional in the operation of the Hungarian pharmacy system, the sustainability of pharmacists as key players in the Hungarian healthcare system. So, what has done in 2010? In 2010, after the new parliamentary elections, the new government announced a moratorium for establishing any new pharmacies till the end of the year. During this 6 months, they made a detailed study on the whole healthcare sector, including pharmacy. This plan, called the Semmelweis Plan in Hungary, item H is dealing with pharmaceuticals and medical devices policy. During the 6 months, it was also predictable that we are going to have a new legislation in Hungary, new criteria for establishment and ownership. The regulation of the pharmacy sector was an example for the new government because pharmacists represent the classical citizen, the citizenship for them. They wanted to restore the reputation of professionals, not only the pharmaceutical professional, but any other liberal professions in Hungary. So we have to say we were a little bit lucky as a pharmacist that we had the same aims that our government had in 2010. So what are the actions taken in 2011? The new or reintroduced elements are the demographic, geographic and ownership criteria. You can see them here, but I think not the numbers are the really important things, although I have to mention that the rule is 4,500 inhabitants per pharmacy in general now in Hungary. But the most important thing I believe is the ownership criteria. I think all of you sitting here and know these numbers that in Hungary, by the year 2014, the membership for the pharmacist has to be at least 25%, and for 2017, 51%. But all the time, the most interesting things are behind the scenes and in the small letters. As in the small letters, just if you have a bank contract or something like that. So when we have a loop, we can see behind what it says. The Hungarian legislation says no more chain development, but existing chains can stay. So who are already in the country, who have been already in the country in 2011, that chain could stay, but no more development, no spreading all around the country. Offshore companies were excluded from pharmacy operation, but it was a general rule in Hungary that an offshore company could not get governmental concessions on any other fields or cannot be in connection with the public money. Some more things. That 25% or the 51% doesn't mean only share. It also means that the share of the pharmacist has to be equal in the company. 25% of share means 25% of vote and 25% from the earnings of the company at the end. Also, the syndication is prohibited legally in the last 4 years, and there's a special right of preemption, what means that if anyone sells the ownership share in a company running a pharmacy, the first one who can buy it is the pharmacist who is leading the pharmacy. Secondly, the pharmacist who is employed working in the pharmacy. Thirdly, if they don't want to buy the share, it is published, it is advertised for all pharmacies on the operating register in Hungary. And if no one in Hungary as a pharmacist wants to buy the share in this pharmacy, then the Hungarian state has the right to buy the share. And if no pharmacist and no the state wanted to buy it, then anyone else can buy it. So we also rebuilt our competencies. It is just only a few examples how we imagine the reintegration of pharmacists into the healthcare system, accepting special healthcare pharmaceutical care protocols, and also we had some new financing models, because from 2012 the Hungarian pharmacists can earn money not only with dispensing pharmacies, but for services. More than 30 million euros can we get from the National Health Insurance Company for generic substitution and for any other pharmacy services we are providing for the patients. I also have to mention the special loan program for pharmacists, because pharmacists could not afford buying the shares from the companies who want to sell them. These special loan programs are subsidized according to the European de minimis legislation, so they have special interest rates, but they are only available for pharmacists. And there's a special formula is given to calculate the maximum loan what a pharmacist can receive. Why I'm showing this for you? Because there's a big misunderstanding, I think, that everyone says that the Hungarian government set the price of the pharmacists. Nothing did that. This legislation says only if I, as Attila Horváth, would like to buy as a pharmacist a share in a pharmacy, it is the special loan what I could get. If I have enough money, I can make an agreement to buy the share. But if I would like to have a loan for this, this is the formula, what is the maximum money I'm going to get. So it doesn't mean that anyone set the price of the share or the value of the pharmacies. It is a formula only for the loan calculating in Hungary. So was the first step successful after this? Because now it's 2015 and we are 1 year after 2014. As we can see, when this law was introduced in Hungary, we had 714 pharmacies who not fulfilled the criteria and had less ownership share for pharmacists as the 25%. It makes the 1/3 of the pharmacies. After 2.5 years, so beginning of 2014, we had only 2 pharmacies who could not manage it to get the bigger shares. So going back, so only 2 pharmacies which was failed. What is happening with these 2 pharmacies? The law says if anyone hasn't meet these criteria, the National Health Insurance Company terminates the contract with them for dispensing reimbursed medicines. So they can operate, but they are not able to dispense reimbursed medicine in Hungary. Telling you the truth, Hungary has become a part of a formal notice process too. beginning last year, and in the response of the Hungarian government, we refer to the case law, the cases 171 and 172. And I have to tell you that this formal notice hasn't turned into infringement procedure. According to our law, there is only 1 year and 4 months to the final deadline. It is the beginning of 2017. Before ending my presentation, I would like to quote some sentences from the curious judgment from 2009, and I believe the last sentence is enough to read. Non-pharmacist is making a profit would not be tempered in a manner equivalent to the self-employed pharmacist, and the fact that pharmacists, when employees work under an operator, could make it difficult for them to oppose instruction given by him. Because these sentences are among the fundaments of our old new system, which prefer to serve the need of the patient. And in Greece, we have to remember to Hippocrates, he 400 years before Kraft already stated, well-being of the patient is the most important law. So I think in Hungary, the question of liberalization and pharmacy model is decided. So we have chosen this kind of model, but I'm afraid in many European countries, not yet. Thank you for your attention.
Ευχαριστούμε θερμά τον Attila.
We'd like to thank Attila, a colleague that